So the section we're going to concentrate on now is the forehead. Now, our patient, unfortunately, is resistant to botulinum toxin, so we can't use Botox for these areas. So what we're going to do, we're going to use some tin screws for the actual static lines you can see in the glabella, and we're going to distribute the 50 millimeter needles, 38 millimeter needles across the forehead in a pattern like this. All right, because what we want is contraction that way. So we'll start off with the twin screws. So we want to insert them here, so we're going to come back to here. I can see there's a little vein there, I've got to try and avoid that. So we're going to just pop into the skin and come along. I'm going to aim for that static line. I've actually used the same hole. We'll just pop in again. Now this one will overlap with the first one. We won't go in just as far, so we're going to have some overlap of the PDO, and you can see the lines starting to improve already. So we're going to use 10 of the Tornados and 40 of the 3850 monos. So that's our 50 for this area. So we've improved the contour of that. There's a little bit of swelling there, but we're just going to wait for that collagen to kick in and those lines should be better. Now we're going to focus on the horizontal forehead line. So we're going to be placing our threads this way because our tightening is going to be in this direction. Okay, so we've got our 38 millimeter needles with the 50 millimeter thread. We're just going to come to the midline. So we're going to enter in about here, and then we'll just do parallel rows like this. And we've got 40 to play with. So the forehead generally has a bit of a curve for most patients, so you're still going to be careful of your depth. Okay, so this is where it gets a little bit tricky because you're now going to come behind the first row of threads. You could potentially just pull them out. I'm going to try and just come in below and place these second set of threads in between the first set of threads, so we've got an overlapping an arrangement of the monos. So roughly parallel. So in some patients you might be able to fit 10 and 10. Some patients will have a lower forehead, so you'll be able to fit less. So you just got to, there's no hard and fast way of doing it. You can just do a couple of rows, but as long as you use all the threads that you want to, that's fine. So the first lot of threads, we went in here, so they've come to here. The second lot of threads have overlapped by about 5 millimeters, so they come back to here. So what we could do is just come back a tiny bit further, and we'll do 5 along there. One more on this side. All right, so we're just going to complete the other side. Just measure up to the midline. So as I say, you don't really need to leave them in if you don't want to. It's just that when you've got a lot of threads you've got to fit into a small area, it's often easier just to take the first row out and pop the second lot in. You'll know where you've been because you can see the little entry holes. So now the forehead is prone to bruising because there's a lot of superficial veins that traverse the area. So you can see we've got a couple of little bruises there. Happy for patients to use a little bit of arnica, some ice for the first few days to help that settle a little bit faster. If you've got a laser, potentially you could use your Nd:YAG laser to try and resolve that a bit faster as well. We're just going to pop our last 4 in. So we're just going to come around a bit further around the lateral forehead. Now the patient's got the budget. I mean, I'd usually recommend at least 50 for the forehead, but you could definitely fit 100 in. And if the patient's got the budget, yeah, go for it.